just start, first of all, by saying how much the Lieutenant Governor and I are thrilled to be here today with Secretary of Housing and Economic Development Mike Keneally, Executive Director of the Mass Tech Collaborative Carolyn Kirk, with Jim Davis, who's the CEO and sort of North Star for all of the folks here at New Balance, and Charlie Abrams, who's the President of Della Inc. out of Haverhill. I also want to thank Kevin for that terrific tour, and it's great to be with you, Mr. Mayor, Dan Rivera, the mayor here in Lawrence, and you got Senator Barry Feingold, State Rep Marco Devers, State Rep Carol, I always screw up your last name, Minicucci, and State Representative Frank Moran, and many, many others. And I just want to say how much we appreciate this chance to talk a little bit about yet another great organization here in Massachusetts, a manufacturing company that is pivoted to create personal protective equipment for people here in the Commonwealth and elsewhere as part of their commitment to ensuring that we do all we can to make sure people have the gear they need to stay safe in a COVID-19 world. They have produced at this point over 1 million masks of one kind or another to help combat the COVID-19 public health emergency. And before I say a little bit more about this, I do want to give an update, as I do every day, on how we're doing with respect to hospitalizations and testing and further increasing data collection at DPH. As we begin phase 2 here in Massachusetts, which started yesterday, the public health data continues to trend in the right direction. As of yesterday, we've done over 650,000 tests, which makes us a top 5 per capita test player here in the United States. And if we were a country, we'd be one of the top testers on a per capita basis in the world. The average positive test rate is now down to around 4.9%. That's obviously a very significant reduction, over 60% reduction in the number of positive tests as a percent of tests done over the course of the past month. The number of people who remained hospitalized due to COVID is down to about 1,462. That's obviously down dramatically, over 50% since the middle of April. And we continue to anticipate and hope that we see those positive trends as we continue to move forward in phase 2. We'll also continue to expand our testing capacity here in Massachusetts and our contact tracing activity as we move forward. I mean, throughout this crisis, we've been pretty aggressive about expanding our ability to provide information that's particular and important to COVID-19 to the public. And yesterday, we filed an act to ensure the collection of COVID-19 data, which builds on the legislation that was recently passed by our colleagues in the legislature that we signed into law on Sunday night. COVID-19 has obviously taken a tremendous toll on the residents of the Commonwealth and has disproportionately impacted certain populations, including older residents and folks in communities of color. This bill that our administration filed will expand our data collection capability to help address the health disparities and the information that's available with respect to these communities. Currently, the law makes clear that DPH is required to collect data on COVID-19 cases and patient demographics, but what's not so clear is what the provider community and the lab community has to submit to DPH. Since the integrity of DPH's data is dependent on what we get from those entities, this bill would amend the reporting law to require that that information be reported by those other participants in the data collection and service delivery supply chain. We believe that this will help improve the spirit of the law to have accurate and complete reporting and to have everybody who's part of that process compelled to actually deliver the information that we'll be looking for on a timely basis. That, in some respects, gives us the ability to ensure that we get the data we need in the most complete form possible. And for those who don't file under the legislation we submitted, DPH would have the ability to issue fines to those who don't deliver the data. We're also proposing other amendments to address data collection and aggregation. The new law that I signed requires designated elder care facilities to report COVID-19 data for residents and staff. Certainly improved data collection makes sense for nursing homes and skilled nursing facilities who play a critical role with respect to patient care, but the law also includes elder housing complexes, which could come with a few problems. Landlords, generally speaking, do not and should not have access to a tenant's private health care records, nor should they have the burden of reporting that to the Department of Public Health. Our legislation would remove elder housing complexes as a designated reporter. It also includes language to allow DPH to lawfully aggregate this data. Accurate and detailed information is an integral part of our understanding in fighting COVID-19, and we continue to support efforts here in Massachusetts to expand and enhance our capacity to deliver on that. There are also a number of important components to the bill that we signed into law that everybody agreed were the right thing to do. We're hopeful that the new legislation will help put a finer point on data collection for seniors and ensure that DPH has access to complete information to identify infection rates and health disparities across the Commonwealth. And we look forward to working with the legislature to pass these updates to help further ensure that we get the information we need and that we can do what needs to be done to address health disparities affecting these communities. This is one. Today we are here at New Balance in Lawrence. The Lieutenant Governor and I have both been here on a number of occasions to talk to these folks about manufacturing in Massachusetts and making footwear. We've done a few of these visits around companies and organizations that have pivoted to create PPE here in Massachusetts. Many of them are partners of ours through the Massachusetts Manufacturing Emergency Response Team, so-called MERT. The initial goal was to get PPE in the door to support our frontline healthcare workers and protect patients from COVID-19. The MERT was helped by executives from our leading healthcare institutions, including folks at Beth Israel Lahey, Mass General Brigham, and a number of others, to provide direct feedback on the needs of frontline healthcare workers, and we were also helped by experts at the Lincoln Lab at MIT and a number of other academic and research institutions. Demand for PPE in the healthcare sector still exists, but so does demand for other types of supplies like face coverings and gowns that businesses, child care centers, and manufacturers, among others, need to reopen. And we're proud that so many Massachusetts manufacturers have stepped up, like New Balance has, and will be there to meet this demand in the months ahead. The MERT program helped New Balance with regulatory assistance, coordinated some supply chain needs, and access to testing products. We had experts from MIT who held bi-weekly meetings with New Balance to talk with them about the regulatory environment with respect to the supplies they were looking for, and the Advanced Functional Fabrics of America Institute that's located in Cambridge also provided guidance around testing. In the short amount of time, New Balance, as I said, has been able to produce over 1 million masks. They've also helped repair straps on 50,000 masks for Brigham and Women's Hospital that were initially degraded when the hospital received the equipment. And to Jim and to the rest of the New Balance team, I just want to say thank you for your efforts to not just continue to be a great employer and manufacturer here in the Commonwealth, but to diversify your product line so that you could be part of the answer to how we deal with and fight COVID-19 here in Massachusetts. We're enormously grateful for your efforts. We certainly know that the work is not done, but to be able to go from zero to actually producing PPE face masks here in Massachusetts in 4 days, as I understand from the conversation we just had, obviously is extraordinary. All the companies here in Massachusetts that have participated in the MERT program have produced nearly 4 million items of PPE in about 120 days. It's quite a story. Last week, we launched a new business accelerator program to get even more of Massachusetts manufacturers on our MERT pipeline to produce PPE and other supplies for employers, businesses, and individuals here in Massachusetts. We're obviously very grateful to Carolyn Kirk and the Mass Tech team for the role they've played in making all this happen, and we're looking forward to seeing this new accelerator program build on the work that's been done to date so that we can continue to make sure that people can source, supply, and find the gear that they need right here in the Commonwealth. I want to thank all the manufacturers and suppliers who've been part of this program so far. It's been a great success story. We look forward to continuing to build on it and to grow additional capacity to support people here in the Commonwealth. And at this point, I want to turn the podium over to the Lieutenant Governor. But again, I want to say special thanks to Jim, to Kevin, and to all the folks at New Balance for this big pivot, which has been so important to our ability to service and support people who are looking for gear here in Massachusetts. LG?
Thank you, Governor, and good morning, everyone. It is great to be back here in Lawrence. I love coming here to be with Mayor Rivera. I see Chief Bask and Chief Moriarty always there for us. It's great to see you. Our colleagues in the legislature, our partners, it's an amazing team. They're all here this morning. And I do want to acknowledge Jim Davis. What a strong leader. And it wasn't a surprise to us that he wanted to do his part and engage his team here and the talent that is obviously a part of it to do something to help the people of this Commonwealth, especially those on the front line. It's great to be able to see it in action firsthand today. So to all the workers who are here as part of this project, we are very grateful, and we join you in feeling very proud of what you've been able to accomplish. So thank you. I'd also like to acknowledge MERT. The Manufacturing Emergency Response Team is what MERT stands for, and Carolyn Kirk and her team doing an amazing job to engage in people like Jim Davis and New Balance to do this, working with your partner organizations like MIT and UMass Lowell to continue to tap into the creativity and innovation that is very much a hallmark of our economy and our success here in the Commonwealth. Yesterday was also an important day in our Commonwealth as we started phase 2 of our reopening plan. And then the days leading up to Saturday's announcement by the governor, we released specific guidance for industry sectors to help businesses, even businesses like here at New Balance, to understand how to meet the safety standards so that when they return their workforce to start making footwear, the workforce knows that these safety measures are in place. So really getting businesses ready. And since Saturday, we've also issued guidance for our libraries, our driving schools, flight schools, occupational schools and testing centers, and we've updated guidance for phase 1 sectors like car washes, pet grooming, manufacturing, hair salons, barbershops, places of worship, office spaces, and laboratories. There's a lot of detail and a lot of information on our website, mass.gov/reopening, and it's a really important resource for you to go to and study the guidances so that you can also get ready to reopen. The start of phase 2 is encouraging, though COVID-19 is still here. And it marks progress thanks to everyone's compliance, doing their part every day, and businesses opening with these safety measures in place. And so we've asked a lot of the people of this Commonwealth, and we've asked a lot of the businesses to adapt to these new standards. And we're also going to ask a lot of you as a customer when you start to make choices about where to go and what to do outside of your home workplaces. So you need to continue to wear the face coverings and keep distance from others and continue the hygiene and sanitation that is very much a part of our daily routine. And as we reopen and we restart our economy, it's important that we continue to think about the places and the people and the businesses in your community that you're so connected to, and that once perhaps you took for granted, now you need to be intentional around making sure you support them. So buying locally, visiting locally, finding new destinations in the Commonwealth that perhaps you just never got to, and to think about bringing yourselves and your families to those places in Massachusetts. So buying from your local and small businesses, thinking about your main streets and your downtowns and the family-owned restaurants, the new boutique that might have opened that you can't wait to go back to. And to be able to do this is really, again, you doing your part to helping our businesses get back up on and running and back on their feet so that they can continue to operate here in our Commonwealth. I want to say, as the governor said, how proud we are of the residents of this Commonwealth, of businesses like here at New Balance, for the workers who understand what their roles are in this fight against COVID and their responsibilities to get to work and to be able to provide for their families. We are very grateful, and I just want to say it's been a real pleasure to see this firsthand today and to understand the pivot that so many of our Massachusetts businesses have undertaken to help us create the equipment and the things needed to both fight COVID spread, but also get up and running and get our economy moving again. With that, I'd now like to turn it over to Joe Preston.
Well, good morning, everyone. And on behalf of the Davis family and our 8,000 global associates around the world, I do want to welcome everybody to New Balance Lawrence, one of our 5 New England factories. I was going to say 5 footwear factories, but obviously that's a little bit different now as well. So COVID-19 is a crisis that gathers us here today, but it is not the only crisis that we face as a community. We're watching a movement around the world right now, one that fundamentally calls for mutual respect and leadership as drivers of real change. And today, George Floyd is being remembered at a funeral service in Houston, and our thoughts and prayers are with his family and friends, as well as the demonstrators who are speaking out in a peaceful way. New Balance is a company with a diverse global team that represents many backgrounds, a culture of inclusion, and we are dedicated to bettering the world. We recognize the inequality and fear that communities of color across the United States and around the world live with on a daily basis. Respect for people of all races, beliefs, and backgrounds is part of our DNA. We believe that as a company and individuals, we have a responsibility to help the communities where we operate. And we will use our voice to raise awareness and stand up for our beliefs on this important issue. And we must all work together to promote racial equality and social justice in this country and worldwide. It's an important and defining moment for our society. It needs to be talked about openly. But today we're gathered to talk about another crisis which has had an immeasurable impact on people and companies around the globe. And we're proud to have Governor Charlie Baker and Lieutenant Governor Karen Polito here today. And I want to take a minute to personally thank the Governor and Lieutenant Governor for your steadfast leadership during the past couple of months. I mean, as a citizen, as a parent, and as a leader of a company, your leadership approach has made it easy. It's really kept us safe, and I really want to thank you for it. I also want to recognize and thank the Mayor of Lawrence, Mayor Dan Rivera, for his leadership and tireless work on behalf of the City of Lawrence. Mayor Rivera's in-depth understanding of the local issues and his commitment to community building education has strengthened Lawrence, and we are so proud to support his efforts. Now, who would have thought back in early March that New Balance, an athletic shoe company, would celebrate making 1 million face masks this spring? There's not a chance anybody could have predicted that. But we've always prided ourselves on innovation and creativity, its values in being a purpose-driven company. As such, there was an immediate reaction to the need we saw in the community when the COVID pandemic hit. We knew we had an obligation to step up, quickly adapt, and put engineering, design, and manufacturing capabilities to use. I'm very proud of our teams who demonstrated real leadership in a time of crisis. Their hard work and ingenuity allowed us as a business to quickly move towards production of the face mask, as mentioned earlier, within 4 days. The incredible passion, ability, and creativity of our associates enabled us to pivot effectively and produce PPE for frontline workers in healthcare facilities facing the COVID-19 crisis. I want to recognize Charlie Abrams from Della, Haverhill, a longtime New Balance material supplier and a key partner in getting us here today. Thank you, Charlie. We also applaud the Baker and Polito administration for establishing a strong and highly engaged manufacturing emergency response team that has provided us with meaningful and expert guidance throughout our journey. I want to thank Carolyn Kirk, the Executive Director at the Massachusetts Technology Collaborative, and her academic and industry team members for helping manufacturers statewide like us to transition to PPE. The testing facility that was stood up in May at the University of Lowell, which is right down the street, made a significant difference in our ability to achieve the surgical mask with liquid barrier. New Balance has always believed in supporting our communities in need. Our commitment to domestic manufacturing clearly enabled us to continue this crisis, to contribute to this crisis in a way we could never have imagined. And I want to thank our associates for their hard work and support of our company. We would not be here right now if it wasn't for their passion and their talent. And now I'd like to thank and introduce Dave Wheeler, our Chief Operating Officer for New Balance, to give you a few highlights of our PPE journey. Thank you.
All right. Thank you, Joe. And good morning, everybody. First off, I just want to reemphasize Joe's thank yous to Governor Baker, Lieutenant Governor Polito, and all of our distinguished guests, really for your leadership and partnership as we've worked through this pandemic together, and for visiting us here at our Lawrence manufacturing plant. So thank you very, very much. Just adding on to what Joe just outlined, this has been quite a journey for us. Over the past 10 weeks, we pivoted from, as Joe mentioned, footwear to masks for our healthcare associates, really for the greater cause. And we heard the calls from the state. We heard the calls from our healthcare partners in Massachusetts and in Maine. And we assembled a team, relatively small team, actually 6 people. Started on a Friday. By the time Monday rolled around, we had a prototype in hand. In less than a week, we went into manufacturing of the masks, really at the peak of the pandemic here in Massachusetts. As you know, here at New Balance, we've been developing and making products since 1906, and we certainly know how to do that. I think it's really American innovation at its best. We certainly wouldn't have been successful on our own, and as Joe just mentioned as well, we had a lot of help. We know how to make great footwear. We had to transition into the technology around face masks. And it was really a community effort, one of the best examples of teamwork that I've seen in my career. We were able to pull on and call on experts inside as well as outside of the company, came together as one team, working hand in hand to design, produce, and deliver masks into the hands of those in need. Our success required expertise from Dr. Slavin's team at Mass General, including the Tierney Lab, who stepped up to help us understand not only how to make, but also how to test face masks. Experts from Brigham and Women's, experts from MIT's Langer Lab, and testing expertise from the University of Massachusetts at Lowell. The expert guidance from the emergency response team was just fabulous, Carolyn. Thank you very much for that. Weekly calls, giving us advice. How do we navigate through the channels and make sure we produce a product that's really needed by those in need? And then, of course, the strength of our domestic suppliers. Most prominent, Charlie Abrams and his team from Della, right up the road, raised their hands, did what needed to be done, brought us materials when we were in complete lockdown, and again, able to produce a product within a week and then deliver those into the hands, into the hospital networks, into the nursing homes in very short order. Thank you very much, Charlie. And then, obviously, our internal experts at design, develop, manufacturing to produce not just one version of the mask, but also a second version with improved fit, and now our third version of a mask called the V3. That's actually out there on our .com site for everyone. So we've transitioned from healthcare, making sure we take care of our healthcare workers now, as we all know, to really move into and keep the curve flattened. Wearing face masks out in public is super important, so we made them available to everybody online. And certainly form, fit, and function are at the top of the list, perfectly in sync with the way we make our footwear here in Lawrence, Massachusetts. We've also designed and successfully tested a surgical mask with liquid barrier protection. Not an easy task, as we found out through the process. Finding the right materials, creating the right design, walking through all the various testing to get that certification. We have it ready if and when the state and or healthcare networks become faced with a shortage in the future, which of course we all hope doesn't happen. But we're ready to take the call if that is a need. In parallel to our mask efforts, we've also worked to repair thousands of defective N95 masks for Brigham and Women's. And within our Factory of the Future, we produced a 3D printed stethoscope for use of patients that have COVID-19 bedside, so it can stay right next to them and not increase the spread of COVID-19. And last, I'll just say we built this all on the foundation of the New Balance culture. It's really the fabric of how we do business at New Balance, founded on integrity, responsible leadership, and celebrating our own frontline heroes who craft our products every day. Thank you to our internal team led by Kevin McCoy, our suppliers, our local experts, and our close relationship with the emergency response team. Definitely a shining example of one team coming together for a greater cause, and we couldn't be more humbled to have a chance to contribute to the safety of the public during the fight against COVID-19. So here's to a much brighter 2020 ahead, and thank you very much. I'll turn it back over to the governor.
Questions on this?
Governor, you had mentioned some legislation you were filing. Do you think that there are some people not reporting properly and this is the problem to go after? What's the purpose of the legislation?
I think the purpose of the legislation fundamentally is to create a uniform standard for everybody who's part of that information gathering and distribution and reporting chain. And certainly we've used our emergency orders to encourage people to give us a lot of the data and the information we're looking for, but obviously if all goes according to plan, we won't be in an emergency forever. At some point the order's going to fade away. We would really like to have statutory authority that can sustain this process going forward in place so that there is no doubt about the fact that this isn't something we're expecting people to participate in for just the period of the emergency. We want to have a statutory framework in place that is permanent.
Governor, we learned today that bars have been moved to phase 4. Can you tell us why that is, and are there any other industries that are being moved around?
For the most part, I think the answer to that is that the industries overall have pretty much stayed in whichever phase they were in from the beginning. The big issue with respect to bars is coming up with a model that we believe can actually be done safely. And as we've seen in a number of other places around the country that have moved forward very aggressively, they've started to see a pretty significant rise in new cases, and we're going to work very hard to make sure that doesn't happen here in Massachusetts.
Governor, are you going to test, you're going to use it for increased testing capacity, the number of actual testing performed from the lowest in a couple of weeks compared to a month ago. Even as you increase capacity, what can the state do to start actually increasing the amount of tests that are being performed?
Yeah, I guess the first thing I'd say is what I said in my remarks, which is if we were a country, we'd probably be a top 5 per capita tester in the world. And we're certainly a top 5 per capita tester in the United States. And our goal is to continue to be a very comprehensive and aggressive tester, and to use our tracing program to ensure that we identify people who test positive and their close contacts, and we support them and in whatever way we need to isolate them. But I do think some of the issue with respect to testing generally is driven by demand. And when we have 30% of our tests coming back positive once upon a time, 30, 40 days ago, and now we have on some days under 5% of our tests coming back positive, that changes the nature with respect to who's looking for tests. The rules associated with testing, remember, the goal here, once we get the go-ahead from the feds, will be to test everybody who's symptomatic, everybody who's asymptomatic and a close contact, everybody who works in the healthcare space, everybody who works with vulnerable populations, and to continue to expand the number of sites that are available for testing. We're currently in the process of adding 20 more sites for testing in areas that we consider to be underserved with respect to testing capacity currently. So I certainly believe that our testing, the number of tests and our testing capacity are both going to go up over time, both as we expand the number of places where you can actually get tests and as we make as we make the move into what I would describe as an ongoing testing regimen, especially for populations and workers who are in what I would call sort of high-risk areas.
As phase 2 gets underway, first off, your assessment, I think, over the 2 days in, how does it go with the rollout of phase 2? And are people starting to put their guard down when it comes to COVID-19, mentally and physically?
Well, I would say that we've tried to build a rollout strategy here in Massachusetts based on the data we get from the experts in the public health community and the guidance we get with respect to industry's ability to comply with and deliver on what their industry-specific protocols will be and what the sort of overarching protocols are for employers generally. But I do believe that over the course of time, we're going to see some changes with respect to what we know about the virus, what the best way to combat it is, and what testing capability looks like. I've talked on a number of times with folks in the media and with folks in the infectious disease community about antibody testing. And I do believe at some point we're going to get to the point where we're going to have a couple of antibody tests that are going to be deemed most appropriate, most effective, most accurate. And part of our strategy going forward is going to be to get to the point where we start doing that type of serology testing on a regular routine basis around the Commonwealth to collect data on those who have been exposed to the virus but may never have been tested because for whatever reason they just, either they didn't have a lot of symptoms, they never got very sick, or they just never found their way to the healthcare system. So I do think from our point of view, we are very much still in this fight against COVID. We will be in this fight until there are treatments and vaccines, and I would urge everybody to recognize and understand that it is the decisions that people have made, it is the desire and willingness to wear masks, to create separation, to wash your hands, to clean surfaces off on a regular basis. All of those things that people have done for the past few months is the primary reason why we saw dramatic drops in ICU bed utilization, hospital utilization, positive test rates, sort of all the things that are necessary to make it possible for us to move forward and to get back to work. No one should take their foot off the pedal. I mean, this is still very much a legitimate and dangerous and contagious virus. Well, the big issue with respect to outside and inside is ventilation, right? I mean, if you talk to almost anybody in the space on the infectious disease side, they'll say that recirculating the same air is a problem, a big problem with respect to this virus. And outdoors is outdoors. If you have a tent on the top, you're still outdoors. You're still going to have the benefit of a free flow of air, and that in many respects is one of the the biggest difference when you talk to the infectious disease people about the difference between indoor and outdoor. It's ventilation. I'm not going to speak to that one, but I'll make sure that it shows up on our frequently asked questions. Okay. We have not made any decisions to change our guidance with respect to where we are, with respect to urging people to quarantine if they're from out of state. We've always talked about that as a phase 3 issue, not as a phase 2 issue.
Governor, your healthcare team, I'm wondering, the experts in Massachusetts, they've got some great hospitals. The World Health Organization put out a report saying asymptomatic people may not spread this disease after all, and maybe we should be worried about people coughing and sneezing, not necessarily assuming everybody got it. How does your team come down on that as well?
I've only read the articles. I haven't read the study. But based on the articles I've read, the World Health Organization drew this conclusion from very small sample sizes involving a few contact tracing programs in a number of countries. I was on a call this morning with a bunch of folks from the healthcare community, all of whom basically said they were enormously skeptical of that conclusion for a whole bunch of reasons, and so am I. I mean, I'm skeptical of it for I'm skeptical of it for several reasons. The first is in the antibody testing that's been done on a small scale basis in Massachusetts, every single antibody testing project that's been done in Massachusetts, huge numbers, huge percentages of the people who tested for the coronavirus antibodies, which means they were infected and shedding virus at some point, said they were never sick. Okay? Point number 2 is there is a lot of anecdotal information about the impact that asymptomatic workers in long-term care facilities had with regard to the spread of coronavirus in many long-term care facilities. And finally, there have been a number of very serious scientific studies done on the spread of the virus in other parts of the world that are obviously ahead of us with respect to how much experience they've had with it, in which more than 50% of the spread of cases were deemed to have been delivered by people who are asymptomatic. And the other thing I would say is that there's 2 pieces to the asymptomatic population. The first is, how many days is somebody asymptomatic before they become symptomatic? No one's disputing the fact that those people are infectious, all right? The second is the sample size associated with what the World Health Organization drew a conclusion on, and I'm not an expert here, I'm just relying on what I'm hearing from the people who are, was deemed to be enormously small to make that big a declaration. I continue to believe that based on the advice that we're getting from the health experts here, that people who are asymptomatic, who become symptomatic, are absolutely capable of spreading the infection, and so are many of the asymptomatic people who never show symptoms at all. And I would urge people to follow the feedback and the pushback that's going to come from that broad declaration yesterday from a lot of other people who've spent a lot of time trying to figure this virus out. No question, it's unprecedented. No question, we're learning about it as we go. No question, people are changing some of the guidance and the advisories based on information as it becomes available. But I am enormously skeptical of such a broad generalization about something where there is so much data and information already available that says just the opposite.
Governor, are you able to draw any conclusions from Massachusetts' own contact tracing program of asymptomatic spread versus symptomatic spread? Is that right?
Most of the conversations we've had so far have literally just been about isolation. I'll check with those folks and see what they say about that.
Also, I want to ask you, the Attorney General of State Owners said this week that they would voice support for the proposed system when it comes to recertification. Is that something you support as well?
There are a bunch of states. I think actually most states have some sort of a post program in place. That is one of the things we've been talking to the caucus about, to the Black and Latino caucus. And thank you.